Hi, everyone. I'm here as usual every week with Dr. Nario. How you doing, Doc?
Pretty good, Steve. How are you doing? Thank you for
Uh,
inviting me again.
I'm great. So we're going to talk about DHEA, a big deal with people's hormones. I guess you're going to kind of relate it to, does it change or what's the need as people get older? I know it converts to testosterone, but I'm interested to hear what you say about this. So, Dr. Nario is at Biointegrative Health Center in Reno, Nevada. You can check them out online and see what kind of treatments they do. A lot of IV treatments, so you can see what they do. Check them out online. If you're interested in our weight loss program, use the QR code on the screen or the link in the description. Okay, so DHEA. I recently got my blood work done, and I do take a little bit of DHEA, but you recommended that I bump it up. So let's start with, what is it?
Yeah. So, Steve, DHEA is, again, a hormone often overlooked but deeply influential. Whether you're aiming for better energy, muscle strength, physical wellness, and graceful aging, DHEA deserves a closer look. And the term, don't even bother remembering it. What it means is dihydroepiandrosterone. So that's why I call it DHEA. Don't try to kind of make your brain cells work that way. It's produced in your adrenal glands and it's a precursor to our hormones such as testosterone and estrogen. So that's why it kind of trickles down into like that game when you put like a little penny, it goes down and it turns into something
The
else.
marble.
The marble, yeah, there you go. So it
Know
peaks.
where it's going to go.
That's right. So it's just a dynamic type of hormone, and it peaks in your 20s and declines 2% per year. So 80% dropping again by age 70 is almost like 80% drop. And it's always linked to resilience, biological age, recovery, and sexual vitality.
Oh, you said it converts to testosterone and estrogen.
Yes, it can. That's true.
Determines what it converts to.
So this is a feature of DHEA and really how the body is a wonderful machinery. Whatever you're lacking, it will actually go to. That's why I tell you, it kind of has a mind of its own. That marble, wherever it goes, it knows that it needs more. This body needs more estrogen. This body needs more testosterone. So it really actually depends on what the deficient hormone is, and that's why it's a good thing that it turns into other hormones. But for us clinicians, we have to make sure we monitor this. So if people are on testosterone, it might aggravate their current levels of testosterone. Same for estrogen. So it's a double-edged sword, but always it's always going to be considered as the one of the plus characteristics of DHEA.
If you're on TRT and you take too much DHEA, that could make your testosterone too high.
So yeah, so that's a good question. Majority of the one who converts more of DHEA into testosterone will be women. So we are more cautious about this. I'm not saying men would not experience that, just because of course they have their own testosterone. Like for example, right? Somebody's already on TRT, so you would notice that DHEA, if taken, would just increase DHEA rather than T by itself. But can it contribute a little bit to increase that T of a man that's on TRT replacement? It can. But the women, that's the one, they're the ones who really are not dependent much on testosterone, but DHEA has been successful to raise their numbers just using DHEA alone.
Why is it important? You said that our bodies produce less, but why is it important and what does it do for people who are aging?
Right. Well, Steve, DHEA and longevity, so low DHEA levels actually increases all-cause mortality, frailty, sarcopenia, or losing muscle, and insulin resistance, diabetes, right? Cognitive function and brain function, this is actually suggesting that DHEA, recent data showed that it actually provides neuroprotection or brain protection. It even supports telomeres, right? The lengthening of the gene structure, and also immune balance. We give this a lot to, for example, cancer patients or immunocompromised, and even your HPA axis resilience, meaning the stress response. So the cortisol levels works hand in hand with DHEA. It keeps it down. And clinical pearl, most of the time, DHEA often declines during burnout, trauma, and even chronic illness. So we don't chase anti-aging fads, but in integrative medicine, we do measure what the body needs to stay resilient.
Okay. And we don't talk about this a lot, but just describe integrative medicine compared to your most people's general practitioner, how you're different and how you're looking at the body. I mean, a just total random question, but I think it's important for our audience to know.
All right. Well, let's phrase it in a DHEA answer then, so it can be related to our topic. So
Okay,
when
perfect.
you're using DHEA in a conventional way, you're only focused on one specific action for DHEA, and majority of the actions of DHEA are being used in the conventional world. A good example would be women. Women who uses a cream, which is DHEA, to actually prevent vaginal dryness. So that's something. It's a prescription that they use, and that's how you kind of see that the lens of of a conventional model is just focused on one. But when you talk about integrative medicine, now you're going to think about DHEA not only for vaginal dryness, but as I mentioned to you, this is something that's used for longevity, but also I use it, for example, like athletes. So athletes, muscle mass, recovery time, stamina, and anabolic balance. Even as I mentioned to you, cortisol, so that your cortisol stress levels are not going to be imbalanced when you're using DHEA during fatigue, burnout, or mood crashes. And that's why the rate we also measure ratios of DHEA and cortisol just to understand where is the stress resilience is. And it's also used for middle-aged athletes and adrenal fatigue and chronically stressed professionals. So you wouldn't hear that conversation in a conventional model. But you would notice here, I already gave our longevity biohackers tips there. But now we go into the athletic part of where DHEA becomes useful.
Why, or what happens when it's low? Why is that not good?
So low DHEA, actually, as I mentioned to you, it comes from your adrenal glands. So meaning, number one, you think about, is the adrenal gland not functioning well? It's not producing the right amount of hormones, right? And what is causing that decrease? So could it be one? There's number one in the integrative world would be stress, because DHEA balances cortisol, and it actually comes to a point that if the adrenal glands cannot spit out DHEA anymore, does it mean that adrenal is, as we call fatigue, but we don't like to use that term, but that's the more familiar one. But is that something that's overstressed? And now we need to address the stress that's doing this to the body. And DHEA, when it's low, it also correlates to an immune system that functions lower. So you are prone more to illnesses and diseases. And as we know, as I mentioned to you, precursor of hormones. So that's something that we're concerned about. Is there something going on with that feedback? Why is DHEA low? Is it because testosterone and estrogen are so high that the body's saying, "Hey, we don't need DHEA anymore"? So really, there's so many reasons. But again, low DHEA is commonly seen in the integrative world because of stress.
Oh, this might be a dumb question, but
No dumb questions.
is okay, cortisol high because DHEA is low, or is DHEA low because cortisol is high?
So like the chicken or the egg question, right?
Dove.
So there are three phases here in terms of how our body responds in relation to DHEA and cortisol. So the first stage would be adaptation phase, wherein the cortisol is high and DHEA may be normal or also elevated. This means that the body is trying to keep up with the stress that you're going through. That's why, hey, let's create more cortisol, let's bump up a little DHEA. And as you move forward, if that stress is still present, the the cortisol starts to now dwindle down. And then DHEA also tries to increase it a little bit more. So you would notice in that second phase, DHEA is a little higher than when you started it with, because it's trying to compensate for that dip of cortisol. So you would see it's like, I want to compare DHEA as like training wheels on your bike. If you're about to fall, it will catch you. But eventually, at that final stage of adrenal stress or fatigue, or hypoadrenalism, as we cortisolism as we call it, now the training wheels cannot catch you anymore. It's like, hey, you're too heavy. You're giving me too much stress. Now both of them will be lowered down. So that would be phase three of how these specific patterns of DHEA and cortisol responses would be seen when you plot it on a graph.
Okay, so DHEA is just you can take it simply as a supplement over the counter, right?
Yes, that's kind of like, I don't know if it's a good thing or a bad thing. In overseas, you need a prescription for DHEA. It's just that when I mentioned to you that it can actually be be part of the hormone therapy that we use. It's unfortunate that it's also banned in athletics in other countries. So this is WADA. I don't know if you heard of WADA, but they found that you're using DHEA, there that could be a cause of problems for your competition. So as you could see, that some countries are so tight about this, because yes, it can turn into these, like especially testosterone. But again, in the states, it's just a free for all. Unfortunately, that's why I always want to advise medical assistance when you use this.
Okay, I was going to go there. So I know DHEA comes in 10 milligrams, 25 milligrams, 50 milligrams, and 100 milligrams capsules. So it sounds like you recommend that you don't just go pick one willy nilly and start taking DHEA without talking to your physician. Is that right?
That is correct. Just the reason for that would be a good example for you, PCOS. So there are a lot of PCOS. It's almost like 50% in the population. If you add more androgens to these people, or especially basically more of women, reproductive stage or age women, if you add more DHEA to their already high androgen level, you can worsen their symptoms like hirsutism, oiliness of the skin, irregular menses, right? In manly characteristics. So doing this freely, it's a hit or miss. And when you mentioned about the doses, women usually start on the lower end, because I told you they're not dependent on testosterone, which is the most common conversion of DHEA. So we start them around 525 milligrams. And for men, they do need a little higher of this, just because this is something that they either use more of compared to women. So they start at 25 to 50 milligrams per day. So not only is it in capsule form, you also have like sublingual liquids that you can put under your tongue, and also compounded creams. But yeah, the most common one that's available out there is the oral capsules.
I was doing 25 milligrams. You bumped me up to 50. So it really is different. Every person, their age, their blood work. There's a lot of factors on even whether you should take DHEA, and some people don't need it at all, right?
Yeah, so because you really DHEA, especially for active people, I see that it's harder to dip that DHEA down. And also, if let's say you're just, yeah, you're just younger, definitely that number is not being needed, because your adrenal glands are still working. So it's not for everybody. Uh, though we kind of stack it with other protocols, so that at least you could use the most minimal dose of DHEA. Like for example, for performance and stress, I add maca there, ashwagandha, zinc, and omega threes. If it's for libido, I add tribulus, L-arginine, and panax ginseng. So it really is. If your best bet here is not to go higher, because the body will get used to that specific dose, and now you don't have any more leeway. So the lower dose you could do, the better.
Yeah, so um, I guess it's everyone's different, and age matters, probably your activity and all that stuff on getting your dose right. And I think another thing with integrative medicine, which is where you are, is you're also shooting for ideal. Because even though my DHEA is in the normal level, you want to see it a little higher because you want it to be optimal, not just normal.
Right. Yes, because when you talk about optimal, it's like the normal range, an example for you, vitamin D, 30 to 100. I mean, I don't like my patients to be around 30 just because tomorrow, who knows if you're 29 and now you're deficient, right? So I always like that buffer. And also, when I say a little higher above the in terms of the average, which is the middle, you definitely have a higher chance of resolving symptoms. It's not like you're overdosing on it, but you just definitely have more cushion. If, let's say, hey, I went on vacation, didn't take my DHEA, all right, at least it went down, but it's still in the normal range.
Anything else on DHEA, why it's important? Or
Yeah.
any, go ahead.
Yeah. Well, so one thing that I've been kind of using DHE on lately is actually sexual health. So there is actually studies that have shown that it can boost libido, especially if your testosterone is low, and also if DHEA levels are low, or even improvements in erectile dysfunction. So that's definitely something that's out there that our men patients are having issues with. So that's for men, but for women, improves libido, increases arousal, and as I mentioned to you, improve the vaginal atrophy, which is more of the cream though, not the oral ones. And this is actually approved, as I mentioned to you, the cream for women by the FDA for pain during intercourse. So the medication is Prasteron, as you could see, and you can ask that from your doctor if you want insurance to cover for that. And also, it helps with sexual desire and satisfaction. And this is something that we're always thinking about Viagra. We're thinking about any aphrodisiac out there like herbs. But DHEA, as I mentioned to you, the wonder of that, it's over the counter here. And that's definitely something that's already in the arsenal, but you have to use it the right.
All right, so that's another uh, positive reason why you might want to or need DHEA. So, any last thoughts, Doc?
Right. Well, see, DHEA is much more than a hormone. As you can see, it's actually a biomarker of resilience, as you were asking about the cortisol questions. When used wisely, it can help maintain energy, performance, and intimacy in later years in relation to the sexual benefit that it brings. But the secret isn't just in the supplement, it's the strategy. So using the Swiss Army knife of DHEA definitely puts a lot in your toolbox when, especially for your provider, in terms of addressing all of these hormonal issues. So think of DHEA in relation to maybe I can solve DHEA even before I go into testosterone therapy, right? So again, cheaper and even a more a good first line type of approach.
So, there's lots of reasons, and you just got to kind of experiment with it. It sounds for different doses for different ages and different symptoms, right?
And
All
remember
right.
that that's very important for, as you mentioned there. Women use smaller, men you use bigger. I've seen patients on 25 milligrams from the get go, and that's too high. They're gonna come in with hair growth. They're gonna be coming in oily skin, acne, and thinking that, oh yeah, I'm not on testosterone. What's doing this to me? And I find out DHA was the culprit. You're taking too much. Men doses are different from women dosing.
Because it's androgenic. A woman would take maybe 10 milligrams, right?
Right, 5 to 10 milligrams would be a good start.
Even every other day.
Yeah, you can definitely do that.
Okay, well, doctor, as always, thanks for being with us, and we'll see you next week.
Well, Steve, thank you so much for having me. As we all know, that knowledge is power. And thank you for letting me provide you with edge on longevity and health maintenance, which I call the biological edge or the bio edge.